Doctors at some of Canada's busiest hospitals are raising the alarm about a looming crisis. They say the system for urgent care in the country is on the brink of failure owing to a lack of funding and staffing shortages. Brett Ruskin is looking into the doctor's warning for us, including a public letter, an open letter, Brett, that has just been released by doctors in Calgary. Tell us more.
That's right, Heather. This letter out this week, just one of the many groups of doctors speaking out about their concerns that are happening and being felt from coast to coast to coast. So let's start on the West Coast. We have seen doctors speaking out there, asking for assistance, asking for support for the healthcare system, with most recently one senior physician at one of the busiest hospitals in British Columbia in the Surrey area talking about how he has doubts, concerns. He may not even bring his own family members if they're sick to his own hospital. Here he is speaking a short time ago.
Lots of time, these patients are not seen for 24, 48, and sometimes 72 hours. As you will know, the first 48 hours of these sick patients, they can deteriorate, they can change status, and it's very, very critical, very, very important that these patients are looked after by physicians.
Let's head one province over to Alberta. That is where that letter was drafted by the 190 physicians in the Calgary area in emergency departments, talking about the capacity crisis that they're currently in. Here's one doctor from the Calgary area talking about the situation that they are seeing.
We are having patients die in the waiting room again. And this is not something that happened in Calgary for many years by and large.
Same concerns elsewhere in the country as well. Ontario seeing some closures of emergency departments. New Brunswick, there has been a launch, or there will soon be a launch, of an inquest into a man who died back in July in Fredericton after waiting in emergency rooms. And then here in Nova Scotia, we obviously know the story of Alison Holtoff, the 37-year-old mother of three who died after waiting for hours in an emergency department here in Nova Scotia. That case, or that matter, that incident now before the courts, with the husband of Alison Holtoff suing the Health Association. Heather.
Brett, are there any solutions in this open letter or in any of the warnings from the doctors? There are so many problems across the country. Any proposals and recommendations?
Well, one problem with this whole issue is that many of the problems are being felt and being duplicated all across the country. So we're taking a look in Alberta. One of the points raised is that people are leaving the profession, or at least leaving Alberta, to head to other provinces. But that's the refrain and the sentiment that's been shared here on the East Coast, with the feeling that nurses and doctors have been leaving the profession burnt out, going to other provinces as well. So we'll have to see if there's any kind of resolution that can be reached with that matter. But also, we've seen the injection of federal funding into the provinces, into the provincial healthcare systems. We'll have to wait and see if that has an effect, and if this is a problem taken seriously by the individual provinces. Heather.
Thank you, Brett Ruskin in Halifax.